Hello, this is for Trach Cares. So prior to doing our procedure, we're going to check the patient's chart, see what kind of tracheostomy they have placed. We're going to make sure that we're going to the correct patient's room. So we would enter the patient's room. Hello, Mr. Blank. My name is Tricia. I'm with the respiratory care team. Today we're going to clean the site around your stoma, your tracheostomy there. Clean that, check it for any redness, swelling, or drainage. Are you having any pain around that site right now? Okay, we'll get things cleaned up and take a look at it, and then you can expect us to do this twice a day. We want to keep that very clean while you're here, so you'll be having somebody do that at least twice a day for you. Can I verify your name and date of birth? Okay, so I'd go wash my hands, make sure I have my kit handy. With my kit, I'm going to make sure I have a little cup or a little area with hydrogen peroxide, and that's going to be mixed with distilled water, sterile saline, a mixture of that, and then I would have another separate one that has just the sterile water or the distilled water in it. We would also have our gauze, we would have our sterile drape, our gloves. So I've washed my hands and I'm going to prepare my kit here. So I've got my kit open. I'm going to go ahead and put my gloves on. And then we would also have suction available. So we would turn on the suction, and Mr. Blank, I'm going to go ahead and suction any extra secretions or anything out of your airway right now here. So we would have that connected. We would go ahead and suction out extra secretions or anything that might be in that trachea area. Dispose of that. Okay. So then what I want to do is I want to remove the existing dressings. So I would untie the ties here, my pretend tracheostomy or my pretend stoma. I'm going to go ahead and keep a finger on that. We want to keep that secure and in place while we're doing this. So keep a finger on that. I've removed the 4x4 that's around that stoma site, discard that. And I'm going to remove my inner cannula. So if it's a disposable one, we're going to remove the inner cannula, throw it away, have a new one placed by us. We're going to put that one back in. If we have one that is not disposable, we would take that one out. We would hold that, put that cannula, keep that close by, and we're going to clean it with our little brush. We're going to outside, inside with that hydrogen peroxide mix. Then what we're going to do is we're going to rinse that off with that sterile saline or that distilled water. Go ahead and rinse on the outside and the inside of that cannula, and then we're going to replace that cannula back in there. Then we're going to clean around that area for you. So we are going to use some Q-tips, and we're going to use that peroxide mix again. We're going to get each side, and we're going to use a clean Q-tip for each area. So side, top, bottom, and then the other side, making sure we're using just one new clean Q-tip with that peroxide mix for each side. If there's any visible debris that those Q-tips are not getting off, then we're going to use that brush, kind of very gently wash around that area. Then we're going to have some Q-tips that have just the normal saline or the distilled water, and we're going to rinse off that peroxide. So we're going to do the same thing. Each individual side gets a new Q-tip. Go ahead and make sure we got all that hydrogen peroxide off, because that hydrogen peroxide can irritate your skin a little bit there, Mr. Blank. So we've done that, and we're going to let that air dry. So then what we're going to do is place a new 4x4, and we are using the pre-cut 4x4s. So this one here, you can see that is pre-cut. We'll place that securely around the stoma site. We want to use the pre-cut because if we cut them ourselves, we could have little strings that kind of straggle a little bit, and we don't want that to get into the airway. So we've let that air dry. We've put that new dressing on. We've looked at the site. It is not red, not swollen. There's no drainage. And then we're going to secure the ties again. So we're going to go ahead and get that all secure, Mr. Blank. Does that feel like it's nice and secure, and I feel like it's in place, secure, not too tight or not too loose? Okay. All right, so that is in place. Then what I'm going to do is listen to those lung sounds again. I'm going to check your oxygen level and make sure everything's going well. That way you feel like you're breathing okay? Okay. All right. Is there anything I can get you before I step out? Okay. Thank you, Mr. Blank.